If you climax but nothing comes out, that's not just age, and it's not something you should ignore. It has 4 main causes, and one of them could be the medication you take every single day. I'm Dr. Jane, a urologist with more than 20 years of experience in men's health, and today I want to explain exactly what's happening when you ejaculate without semen. You might think this is rare, but thousands of men over 50 experience it and never talk about it. They feel the pleasure of orgasm, but nothing comes out, or only a few drops. Some even notice cloudy urine afterward and don't connect the two things. So let's get straight to the point. In the next few minutes, I'll show you 4 possible reasons why this happens. First, when it's completely normal and nothing to worry about. Second, when it's caused by the medication you take every day. Third, when it's the result of surgery or a chronic condition. And fourth, when it's a warning sign, that means you need to see a doctor immediately. Stay with me until the end, because by understanding these 4 causes, you'll know exactly whether what's happening to you is harmless or something that deserves attention. Let's start with what's normal. After a certain age, the male body goes through gradual changes in hormone levels, muscle tone, and nerve sensitivity. The prostate and seminal vesicles, the glands that produce most of your semen, can slow down slightly in production. For some men, this means a smaller amount of fluid is released, and occasionally, a single ejaculation might be almost dry. If this happens once in a while and everything else feels normal, it's not dangerous, it's just part of aging. But when this becomes consistent, every time you reach climax, there's no semen, that's not normal aging anymore. Something else is interfering with your body's mechanism. To understand that, we have to quickly review how ejaculation actually works. When a man becomes aroused, his brain sends signals down the spinal cord to the pelvic region. The testicles produce sperm. The seminal vesicles and prostate add fluids to create semen. Then, during orgasm, a group of tiny muscles contracts rhythmically to push that semen through the urethra and out of the body. There's one small but very important valve at the base of the bladder. Its job is to close tightly during ejaculation, so semen goes outward, not backward. This is the body's natural one-way gate. But sometimes that valve doesn't close properly, and that's when semen goes into the bladder instead of out. Something called retrograde ejaculation. Now, let's talk about the second cause, medication. One of the most common reasons men over 50 lose visible ejaculation is because of a drug called Tamsulosin. It's prescribed to help with enlarged prostate and frequent urination. It relaxes the muscles in your prostate and bladder neck so urine flows more freely. But the same muscle it relaxes is the one that's supposed to close during orgasm. So when it stays open, semen flows backward. You still feel the pleasure, but the ejaculation is invisible. The semen mixes with your urine and comes out later when you urinate. This isn't dangerous, but it can be confusing. Many men panic, thinking something's blocked or that they've lost their masculinity. In reality, it's just a side effect of the drug. The semen is still being produced. It's just taking a different path. I had a patient once, a 68-year-old man who came in worried. He said, "Doctor, I think I lost my ability to ejaculate." We reviewed his medications, and sure enough, he had started Tamsulosin a few months earlier. I explained what was happening, and he sighed in relief. He wasn't broken, his body was just reacting to chemistry. That's why I always tell my patients, if you're taking medication for your prostate, blood pressure, or diabetes, and your ejaculation changes, it may not be your body aging. It could simply be your medication doing its job in one place and interfering in another. Sometimes men combine multiple drugs, for example, Tamsulosin with finasteride or certain antidepressants. Each of these affects the nerves or muscles involved in ejaculation. Together, they can make the effect stronger. But here's the good news. In most cases, if the medication is adjusted or replaced, ejaculation returns to normal within a few weeks. Never stop your medicine on your own, but talk to your doctor. They can often find an alternative that protects both your urinary flow and your sexual function. So far, we've seen that occasional dryness can be normal and that some medications, especially those for the prostate, can make ejaculation go backward. But there's a third cause that deserves attention: surgery. If you've had prostate surgery, bladder surgery, or even certain spinal operations, the small valve that closes during ejaculation can be permanently affected. For example, men who undergo a prostate procedure such as TURP or laser therapy often find that their orgasms feel the same, but nothing comes out afterward. It's not a loss of pleasure, it's a change in direction. The surgery altered the way the valve works. For many, no one ever warned them this could happen. They wake up from surgery happy that they can urinate again, but shocked to find their ejaculation has disappeared. It's not dangerous and it doesn't affect testosterone or erections, but it's emotionally frustrating. One man told me, "I feel like something's missing. The feeling is there, but it's incomplete." And I told him what I'll tell you now: your body didn't forget how to finish, it just finishes differently. You're still capable of pleasure, intimacy, and connection. Then there's the fourth cause: when to see your doctor immediately. If your ejaculation disappears suddenly and you're not taking new medication, if there's pain, blood, or burning, or if your urine becomes persistently cloudy, that's not something to ignore. It could signal an infection, an obstruction, or a more serious prostate condition. In those cases, early evaluation is key. Simple tests, a urine sample, ultrasound, or blood work can reveal the cause quickly. Most problems are easily treated, but only if you don't wait too long. Now, before we move on, let's summarize what we've covered so far. If you ejaculate without semen, it can come from 4 main causes. Sometimes it's a mild, normal variation with age. Sometimes it's the medication you take, like Tamsulosin. Sometimes it's a result of surgery or a nerve issue. And sometimes it's a sign to see your doctor right away. Knowing which category you fit into makes all the difference. Knowledge turns fear into action. In the next part, we'll go deeper into the first 2 causes, how to tell when it's normal aging, and exactly how medications create this change inside your body. You'll learn what happens step by step, what's reversible and what's not, so you can stop worrying and start understanding. When men reach their 50s and 60s, one of the most common misconceptions is that losing semen during ejaculation is simply part of getting older. But that's not true. There's a big difference between a natural decrease in volume and a complete absence of fluid. Your body was designed to function with precision, and when something changes that drastically, it means there's an underlying cause, and often that cause can be identified and fixed. Let's talk first about when this can actually be considered normal. As you age, testosterone levels naturally begin to decline. The glands responsible for producing seminal fluid, the prostate and seminal vesicles, can slow down slightly. This doesn't mean they stop working, it just means they're less efficient. As a result, the amount of semen released can decrease gradually over time. Some men notice a thinner consistency, a smaller amount, or a shorter duration of ejaculation. That's expected, especially after 60. But even then, some amount of semen should still come out. When it doesn't, something else is going on. Sometimes it's a mechanical problem, other times it's chemical. Let's begin with one of the most common chemical causes: medication. The most frequent culprit is a group of drugs known as alpha blockers, used to treat prostate enlargement and urinary issues. The most well-known of them is Tamsulosin. It works by relaxing smooth muscles in your prostate and bladder neck so you can urinate more easily, but those same muscles play a crucial role in ejaculation. During orgasm, your bladder neck is supposed to close tightly so that semen goes out through the urethra, not into the bladder. Tamsulosin keeps that muscle relaxed so it can't close properly. That's why the semen goes the wrong way, backward into the bladder. It's called retrograde ejaculation. You might still feel the same orgasmic sensation, but the semen isn't visible. Later, when you urinate, the semen is expelled, mixed with your urine. That's why you might notice cloudy or milky urine afterward. It's harmless, but it's confusing if no one tells you about it. Let me explain this in simpler terms. Imagine a train that usually travels from the station to the open track. Now, imagine the track switch gets flipped in the wrong direction. The train still moves, but it ends up inside the maintenance tunnel instead of going forward. That's what happens in your body. The muscle that controls the direction is too relaxed, and the fluid ends up where it shouldn't. Most men are never warned about this. They take the medication, notice the change, and panic. Some think it's a blockage, others fear prostate cancer. In reality, it's neither. It's simply a mechanical effect of the medication. I once treated a 72-year-old patient who came to me very worried. He said, "Doctor, I think something's wrong. I had an orgasm, but nothing came out." When I asked what medications he was on, he pulled out a list, and Tamsulosin was right there at the top. I explained that what he was experiencing was retrograde ejaculation, and it was completely harmless. He looked relieved but also a bit frustrated. He told me, "I wish someone had told me this before I started taking it." That frustration is common and it's valid. Many doctors don't explain side effects that affect intimacy because they focus only on the urinary issue. But for men, ejaculation isn't just a biological reflex. It's tied to confidence, masculinity, and connection. When it suddenly changes, it can shake your sense of identity. If this is happening to you and you're taking medication for prostate problems or high blood pressure, it's worth checking whether that's the cause. Besides Tamsulosin, drugs like alfuzosin, doxazosin, and finasteride can also interfere. Certain antidepressants and medications for diabetes or neuropathy may have a similar effect. The good news is that most cases are reversible. Once the medication is changed or adjusted, ejaculation usually returns to normal in a few weeks. But it's important to never stop your medicine without medical supervision. That can cause other complications, especially if you depend on it to manage urinary flow or blood pressure. When I work with patients who face this situation, the first step is always awareness. Once you understand that it's not a disease, but a reversible side effect, the anxiety fades. You stop associating it with failure or aging and start viewing it as a technical issue, which it is. Your body is incredibly adaptable. The same way muscles strengthen when trained, the pelvic muscles can regain coordination when medication interference is removed. Some men even recover partial ejaculation while still on the drug. Their body compensates naturally. Now, there's another situation that's less discussed but just as important. Some men notice that semen still comes out, but it's extremely thin or almost transparent. This can happen when fluid production is reduced, not redirected. The prostate and seminal vesicles might not be producing enough volume due to dehydration, low testosterone, or inflammation. In those cases, lifestyle makes a big difference. Staying hydrated, maintaining a balanced diet rich in zinc and antioxidants, and exercising regularly can improve semen production. Circulation and hormone balance are closely linked to sexual function. Another cause is stress. Chronic stress increases cortisol, which interferes with testosterone and reduces the nerve signals responsible for ejaculation. Many men in their 50s and 60s are still under immense pressure. Work, family, finances, and the body carries that tension into the bedroom. Relaxation, sleep, and mindfulness might sound unrelated, but they directly affect how your nervous system triggers ejaculation. The body isn't designed to feel fear and pleasure at the same time. When it's tense, it chooses survival mode over reproduction. If you've noticed that your ejaculation has weakened, become inconsistent, or disappeared completely, ask yourself 2 questions before panicking. Have I started any new medication recently? And am I under more stress than usual? If the answer to either is yes, the explanation is probably simpler than you think. Now, let's discuss how you can tell whether your situation falls into the normal and harmless category or the needs attention one. The first clue is consistency. If this happened only once or twice and then returned to normal, it's not a cause for worry. But if it's been happening for weeks, every single time, and especially if you've started a new drug recently, it's time to take note. The second clue is sensation. In medication-related cases, the orgasm still feels pleasurable, you just don't see the semen. But if the sensation itself has faded or feels incomplete, there may be a nerve component involved. Third clue, urine appearance. If it's cloudy or slightly milky after climax, that's retrograde ejaculation, harmless and medication-related. If it's painful, dark, or has blood, that's a different story. It could indicate infection or inflammation. Men often tell me they feel embarrassed discussing this, but there's no reason to. This is a biological mechanism, not a moral issue. The more openly you understand it, the faster it can be addressed. By now, you've seen that when you ejaculate without semen, the cause can be as simple as your medication or as complex as a surgical change. But in every case, there's a reason, and that reason can be understood and managed. In the next part, we'll go deeper into surgical and hormonal causes, and what really happens when procedures or imbalances disrupt your body's natural system of release. Now let's talk about what happens after surgery and how hormonal changes or nerve signals can alter your body's natural rhythm of release. For many men, this shift begins after a medical procedure meant to help them, not harm them. It can be confusing because the surgery solves one problem, such as difficulty urinating or prostate enlargement, but it sometimes introduces another subtle change that no one expects. When a man undergoes surgery on or near the prostate, bladder, or lower spine, delicate nerve pathways and muscle fibers can be affected. These nerves act like the electrical wiring that tells your pelvic muscles when to tighten and when to relax. Even a small adjustment in that system can change the way your body completes the process of climax. Take prostate procedures, for example. Operations such as TURP, transurethral resection of the prostate, or laser therapies are designed to improve urine flow by removing or reducing part of the prostate tissue that compresses the urethra. They work beautifully for that purpose. However, in doing so, they sometimes affect the small valve at the base of the bladder that's responsible for keeping the direction of fluid release one way. Once that valve no longer closes as tightly, the fluid can travel in the opposite direction. This phenomenon, often called a backward release, doesn't stop pleasure or desire, but it changes what you see. The sensation remains mostly the same, though some men describe it as slightly shorter or less intense. The body still goes through the same muscular contractions and the same hormonal sequence, but the physical result looks different. Most men are never told this beforehand. They go through surgery, recover, and then, weeks later, are surprised by the change. Some fear that something went wrong. Others blame themselves, believing that they've lost part of their manhood. In truth, nothing is broken. It's simply a redirection of flow caused by a structural change. One of my patients, Mark, age 67, shared his story with me. He had struggled for years with a slow urinary stream, waking up several times a night to use the bathroom. After surgery, he was thrilled to finally sleep through the night, but when intimacy returned, he noticed no visible release. "It feels the same," he told me, "but my body doesn't show it anymore." I explained that this was a natural outcome of his procedure, not a loss of function. Once he understood, his confidence returned almost immediately. That's the power of information. When you understand what's happening inside you, fear disappears. The body becomes less of a mystery and more of a system that can be observed, adjusted, and respected. Now let's look at another factor, hormone balance. Testosterone, often thought of as a simple marker of male vitality, does far more than affect desire. It influences muscle tone, mood, circulation, and nerve signaling, all essential to the body's intimate response. When testosterone levels drop too low, several things happen. The strength of pelvic muscle contractions can decrease. The glands that produce fluid can become less active, and the brain's sensitivity to pleasure signals can dull. This doesn't always mean there's a total absence of release. Sometimes the volume just becomes smaller, the force weaker, or the timing unpredictable. These are all signs that the internal chemistry has shifted. The good news is that hormones can be evaluated easily through blood tests and in many cases balanced through lifestyle changes or medical treatment. But here's something most men don't realize. Low testosterone is often not the root cause. It's a messenger, a reflection of deeper issues like chronic stress, poor sleep, obesity, or metabolic changes. If you focus only on replacing the hormone without addressing the cause, you fix the symptom, not the system. That's why I always remind my patients that hormone balance starts with balance in life. Regular movement, sunlight, hydration, and quality rest are medicine too, just quieter ones. The more stable your daily rhythm, the more consistent your body's internal communication becomes. There's also another player in this story, the nervous system. The process of climax depends on precise timing between two sets of nerves, those that relax the body and those that activate it. If either side gets disrupted, the signal weakens. This is common in men with long-standing diabetes, spinal injuries, or surgeries near the lower back. Diabetes in particular can slowly damage the small nerves that control pelvic muscles. It's like a dimmer switch that gradually reduces the brightness. The signal becomes weaker over time. Many men with diabetes also experience reduced sensation, slower response, and difficulty completing the process. But again, this doesn't mean the situation is hopeless. Improving blood sugar control, increasing physical activity, and maintaining a healthy weight can improve nerve function. Nerves regenerate slowly, but they do regenerate. I've seen patients regain not only better sensation, but also stronger confidence once they commit to consistent habits. Another area worth mentioning is inflammation, especially in the prostate. Chronic inflammation can make the gland swollen and tender, which affects its ability to release fluid normally. Sometimes this inflammation is caused by bacterial infection. Other times, it's the result of poor circulation or a sedentary lifestyle. Sitting for long periods can compress the pelvic area, slowing blood flow and increasing local irritation. If you spend hours sitting every day, take short breaks to stand, stretch, or walk. Simple adjustments like this can have a bigger impact on pelvic health than most people imagine. Hydration also plays a silent role. Thickened body fluids caused by dehydration can make natural release harder to occur. When the body lacks water, the prostate and seminal glands conserve resources, producing less fluid. Something as simple as drinking more water can subtly improve function over time. Then there's the psychological factor, the one people underestimate the most. Anxiety, guilt, or performance pressure can block the body's ability to complete the process. The brain, not the genitals, controls release. If your mind is tense, distracted, or fearful, your body can't relax enough to allow the signal to finish its path. Men are often taught to be silent about fear, but the nervous system doesn't stay quiet. It reacts. Some men describe this as a mental pause during intimacy. Everything feels fine, but just before the final moment, the body holds back. Understanding this is not weakness, it's a protective reflex. When your brain feels safe, your body follows naturally. One of my most memorable cases involved a man named Paul. He was 70, fit, confident, but frustrated. After a mild stroke, his physical recovery was excellent, but he noticed a complete change in his intimate response. He felt desire but couldn't reach completion. "It's like my body forgot how," he said. In truth, it hadn't forgotten. The nerve coordination between brain and pelvis had changed slightly. With time, therapy, and patience, his signals began to synchronize again. That story matters because it shows that recovery isn't about perfection, it's about adaptation. The male body has an incredible ability to rewire itself when given time and support. When hormonal, surgical, or nerve factors are at play, solutions aren't always instant, but they are real. The key is to stay curious, not hopeless. Ask questions. Track what changes after medication adjustments or lifestyle improvements. And above all, remember that pleasure, connection, and identity are not defined by visible results. The truth is that many men over 60 still maintain vibrant, fulfilling intimacy, even with physical changes. What separates those who thrive from those who struggle is mindset. Understanding replaces fear. Patience replaces frustration. If your body has changed, it's not the end of something, it's a transition. Every stage of life brings a new version of strength, and awareness is what unlocks it. In the next part, we'll explore what to do when these changes persist, how to know when to seek help, what questions to ask your doctor, and what natural adjustments can help your body regain balance, circulation, and confidence again. When changes like these persist, it's natural to feel uncertain, to wonder if what's happening can be fixed or if it means something deeper. But the truth is that in most cases, your body isn't broken. It's simply adjusting to chemistry, age, or a past procedure. The goal now is not to chase perfection, but to restore balance. Let's start with when you should talk to your doctor. If you've noticed a consistent change in your release pattern for more than a few weeks, especially after starting a new medication, it's worth bringing up. If you feel pain, pressure, or burning during urination, don't wait. Those are signs of infection or inflammation, not simple side effects. The same goes for blood in your urine or a sudden loss of sensitivity. Early evaluation prevents small problems from turning into big ones. When you visit your doctor, be open about everything. Many men hesitate to discuss intimate changes because they think it sounds embarrassing. But your doctor has heard it all, and these details are the key to solving the issue quickly. Bring a list of your medications, supplements, and any surgeries you've had. Mention when you first noticed the change and whether the pleasure or sensation has shifted. These clues point directly to the cause. If it's medication related, the solution might be as simple as an adjustment. Some men do better with lower doses or different schedules. Others switch to an alternative with fewer side effects. If it's hormonal, blood tests can confirm the imbalance, and treatment can be tailored to restore normal levels. Now, let's talk about what you can do at home. Simple, daily habits that support healthy function and circulation. First, movement. Regular physical activity, walking, swimming, or light resistance exercises, improves blood flow to the pelvic area. Better circulation means better responsiveness. Try to avoid sitting for long periods without standing up. Even 5 minutes of stretching every hour helps oxygen reach those small, deep muscles that support your bladder and prostate. Second, hydration. Water keeps your blood and body fluids moving smoothly. When you're dehydrated, the body conserves fluid by producing less of it. That includes everything from saliva to seminal fluid. Aim for small, steady sips throughout the day instead of large amounts all at once. Third, nutrition. Foods rich in zinc, magnesium, and antioxidants support both hormonal balance and glandular function. Pumpkin seeds, almonds, pomegranates, and leafy greens are small additions that make a big difference over time. Avoid excessive processed foods, sugar, and alcohol. They increase inflammation and interfere with hormone regulation. Fourth, rest. Deep sleep is when your body restores testosterone and nerve communication. Men who sleep less than 6 hours a night often have lower hormone levels and weaker physical responses. Make rest a non-negotiable part of your health routine. And finally, stress. The modern world keeps your body in a constant state of alert. When stress hormones like cortisol remain high, they block the release of the signals that trigger intimacy. Learn to pause, breathe deeply. Stretch your body at the end of the day. When the mind relaxes, the body follows. You might wonder whether natural supplements help. Some men benefit from plant-based extracts that support circulation, things like ginseng, maca root, or L-arginine. But remember, supplements aren't magic pills. They work best when combined with the basics: movement, hydration, and calm. Always discuss them with your doctor before starting, especially if you're already on medication. One thing to keep in mind is that visible release is not the only measure of vitality. Many men attach their confidence to what they can see, but real strength lies in what you can feel: connection, energy, and presence. The body changes with time, but your capacity for closeness doesn't disappear, it evolves. I often tell my patients that sexual health is a reflection of overall health. When you take care of your circulation, hormones, diet, and mind, everything else improves. There's no single pill or secret, only consistent care, and that consistency pays off. I've seen men in their 70s rebuild energy, regain sensation, and restore self-confidence by doing simple things daily. The turning point always comes when they stop focusing on loss and start focusing on maintenance. Let me share a quick story. A man in his late 60s once told me he felt like his body had shut off. He had recovered from prostate surgery, was active and ate well, but his confidence was low. We talked about his habits, long hours of sitting, little stretching, and irregular sleep. He started walking 30 minutes each morning, drinking more water, and doing light pelvic exercises. 3 months later, he came back smiling. "I didn't think small changes would do anything," he said, "but I feel alive again." Sometimes recovery starts with movement, not medicine. So if you've been noticing changes, don't panic and don't give up. The body is far more adaptable than most people realize. With time, awareness, and care, the system rebalances itself. And remember, communication with your partner matters too. Many couples face this in silence, each assuming the other is disappointed or confused. But honesty creates connection. When you share what's happening, you replace fear with understanding. And that understanding deepens intimacy. If fertility is a concern, there are solutions as well. Medical techniques can retrieve viable cells from urine or stimulate normal release temporarily under supervision. These options are safe and effective when guided by a specialist. Most importantly, don't let this issue define you. It's a condition, not a verdict. You're not losing your masculinity, you're learning to work with your body's changes. The men who age best are not the ones who never face problems. They're the ones who adapt with grace. They listen, they learn, and they act. If you've made it this far in our conversation, you already understand more about your body than most men ever do. You've taken the first step, awareness. The next is action. Review your medications, talk to your doctor, move your body, rest, and stay patient with yourself. When you care for your circulation, your mind, and your peace, everything else follows. The body rewards consistency, not perfection. And one last thing, never measure your worth by comparison. Every man's body tells a different story. What matters is not how it looks, but how it functions and how you feel inside it. If this message has helped you understand yourself better, share it. Someone else might be carrying the same questions silently, feeling isolated and unsure. Information is freedom, and you just earned it. Take care of yourself, stay curious, keep moving, and remember, real vitality isn't about age, it's about awareness.